So I think it's important to stress the fact that healthcare is really very broad, and it starts with prevention.
Are we just going around the circle again? I agree with everything you two have said, and I think we need to have a holistic approach to healthcare. One of the things that I think is really important and missing is empowering people to be advocates for themselves, and that happens in different ways. One of them is health literacy, in educating people. There are a lot of people who cannot read or understand anything pamphlets and other things they get, because the majority of people have a 4th grade reading level. And a lot of the pamphlets regarding healthcare or health issues is written in such a way that even if you have a college degree, it's not easy to read and understand. So we need to address that. The other one is, again, as I mentioned before, is cultural competency for providers. The makeup of our society is changing rapidly, and we can't continue to do business the way we've done it in the past. If you go to medical school and come out and you're expected to serve people in inner cities and other places, if you don't understand where these people are coming from, you can't be a good provider for them. So that's another one, is in educating providers in cultural competency. And empowering people who use the healthcare system also means to engage them in prevention. We don't have to be sick. We have choices. We can take care of ourselves. We can look at what we're eating, exercise, and all these things. And if we did the basic things, we become more empowered, and we have a healthier society, which is good for individuals, and it's good for the community and the country. So those are some things.
Could I just add that we could say, as preparation for maybe this is a point to say something like increase access to health care by, and then these are the,
Yes.
and I didn't quite get what you said.
Oh, we need, it's our belief that we need to shift the way we do business pretty much whole cloth. We need to put a focus on prevention when we talk to patients and providers. Incentives have to align differently. Payers ought to be paying for successful outcomes and not for the number of times a patient is seen. It's a pretty wholesale shift in how we look at things.
But we also have to address some of what I consider terrible contradictions we have. We have people dying of cancer. Huge amounts of money are being spent. The insurance will help you with your cancer in the hospital, but they won't pay for your medicine or your prevention of smoking,
Right.
cessation of smoking.
That's right.
And
That's right.
at the other hand, the government is subsidizing tobacco farmers. Now,
Yes.
there is an irrationality there,
Yeah.
in my thinking.
Yeah, and I think the smoking context is a completely the policies that we ought to put forth that deal with smoking cessation we ought not be on the sort of hand-wringing stage that we're at about this right now. I mean, the fact of the matter is it's costing us millions, if not billions of dollars a year. And it's time to address that as a healthcare issue, pure and simple. And I think most of the time when you talk about prevention, we talk about nutrition, we talk about exercise, but the 800-pound gorilla whenever we talk about prevention is either getting people to quit smoking or keeping them from starting.
So your program is mostly about smoking?
No, but that's a component. We need to realign the healthcare system to promote prevention and appropriate management of care. And right now we have a healthcare system that's aligned to treat sickness, and that's pretty much it. We need a shift back to keeping people from getting sick, and that's at every level. It's educating patients, it's educating providers, it's changing the payer system And it's enacting public policies that encourage all of those things.
You asked about what was the main focus of prevention?
Mhm.
I just, maybe this would help. The CDC has listed the 10 leading actual causes of death. Yeah, rather than saying heart, lung, stroke, cancer, they listed it in terms of the number of deaths and years of life, quality of life lost to smoking, overweight, exercise, sexual behavior, drugs, alcohol, violence. And maybe our health system should focus its priorities on the leading causes of preventable death in that kind of order.
Yeah, I think that's an excellent way of saying it, yeah.
I like to think about encouraging, and this is something I'm really always very impressed with Barack Obama's ability to do, but encouraging people to take personal responsibility for their health. In the Reimer core principles here, he makes an analogy to fire departments and police departments as far as healthcare is concerned. But you know, if we use the fire department analogy and then realize that these people are setting their own houses on fire, it's a very difficult system to keep up in the air. So it's I came to this meeting with that in mind, but really being kind of clueless as how to go about doing that. And I think you both mentioned some really good starting points there. So it's something that I feel very strongly about.
But can I ask something about from the physicians in the room? Isn't it too profitable to have catastrophic, cutting edge procedures, either in oncology or let's say triple bypass, angioplasties? Isn't that overdone?
These were developed to deal with existing problems, and we're not saying stop doing it, but start our way of looking at life. And if we were to somehow, let's say, have a tobacco-free country, we wouldn't have many of those deaths and multiple hospitalizations and multiple surgeries from people who are profoundly ill, but profoundly ill because of a habituation, an addiction to nicotine.
I guess where I'm driving at is that there's a reason why in the United States you have these expensive procedures. It's too profitable. Isn't it the elephant in the room is single payer? That's the expression I want to get to, because I looked at internationally what are the statistics in terms of physician error, in terms of really catastrophic intrusive procedures in the 24th hour. And I think we can do better if these procedures, these expensive drugs would not be so profitable. And I think that the key is the funding. I mean, how are we going to fund?
If I may, I don't think that's an attack. I don't think that providers have decided what was going to be profitable for them. And I agree with you. I'm not sure single payer is the only way to get to different things being profitable in the medical industry. We're all sort of talking about the same thing essentially. There are procedures that are paid for that cost tens of thousands of dollars or hundreds of thousands of dollars, and 10 years ago when you could have prevented whatever the condition was that required the hundreds of thousands of dollars worth of procedures, could have been prevented by sending somebody to a nutritionist for a couple $100 a week, but an insurance company didn't cover it. It's not providers who are necessarily deciding which of those are profitable and not profitable. I think there needs to be a conversation about how the payer system works and what's being paid for. We shouldn't be paying for procedures and visits. We should be paying for outcomes more than we are.
And how do you measure those outcomes?
Before we just start the discussion, it would be fine if we could just complete the circle and have everybody suggest what they wanted to see up here.
I'd like to segue then into my area of expertise, so to speak, and that would be a common platform for software and information exchange between providers and all, you know, any sort of healthcare entity, so that everybody's, you know, as far as electronic medical records are concerned, there's still a majority of doctors out there who use paper charts because it's just prohibitively expensive to adopt, you know, a competent electronic medical record system. So I think making an affordable, comprehensive clinical software system available to all healthcare providers that's built to talk with all the other systems is real, actually low-hanging fruit of healthcare reform. Whereas a lot of these other things that we're talking about are absolutely crucial and huge. They're also much more difficult to attain than, you know, getting the right piece of software together and rolling it out. So I think that's